And a calcium score of 0 would play a huge role, absolutely huge role for me.
Welcome to the Fat Emperor podcast. I'm your host, Ivor Cummins. We're supported by the Irish Heart Disease Awareness Charity, which advocates a simple CT scan to reveal your CAC score. So know your score and take action to prevent that premature heart attack. I'm here in Burgoon, Switzerland at the Keto Live conference, and I've caught up again with Dr. John Schoonbee.
Hi, Ivor.
And you are medical director for Swiss Re, which is the first or possibly second biggest Re-Insurer organization worldwide.
That's right. Yeah. So I'm the Chief Medical Officer for the Life and Health Division of Swiss Re.
Right, so you have a huge incentive, you and all your teams and your organization, in very accurately getting life expectancy for high value clients.
Yep, absolutely. So our biggest liability is in life insurance. So it relies on the longevity of the applicants that we reinsure. And by far the biggest risk that we have is that people are more unhealthy and live shorter than we expect them to.
Right, and then you described to me actually surprisingly high value clients where, I mean, what are the higher level sums that people insure themselves for?
Quite shocking numbers actually. We see cases between $50 and $100 million, not infrequently.
Okay, so if you add those up and then the 10 million ones and all, it adds up to a huge sum.
It's big, it's very, very big.
And then you described as well in your talk, I really enjoyed your talk, but you described how a lot of people get lumped into one broad category of risk, but then higher risk people get separated out, but they're particularly high risk usually.
Yeah, it's the principle of insurance really is that you pool groups of people together with similar risk and you charge them a similar premium.
Right, exactly. So one of the things I really wanted to talk to you about was coronary artery calcification. And we were just chatting this morning about the 2018 AHA ACC guidelines have come out.
Yep.
And very big development that the new guidelines have coronary artery calcification with a 2A evidence level rating, which is really high actually. And there's a new direction being set to use coronary calcification for middle risk people to help with, medication decisions. If you're a low score, you have low disease, maybe you don't need a drug that your middle risk would have suggested. But I think for you, you're particularly interested in calcification these days because of really getting a good assessment of risk for people.
Yeah, so we do something called underwriting people when they apply for life cover. And as you've mentioned, the higher sums assured and the people with higher risk, so it would be males, slightly older males, people who smoke, people who are diabetic. We want to make sure that these people don't have coronary artery disease. So traditionally, the industry's slow moving, it's a conservative industry, and traditionally we've used stress tests or exercise ECGs to try and assess whether these people have coronary artery disease. And one of the big problems with stress test is that the specificity and sensitivity is very low. So we see a lot of these ECGs that, of course, it's the electrical activity that the heart shows, and when it's under stress, you see changes in this electrical activity, but you only see these changes in about 2/3 of people with actual obstructive coronary artery disease. So we're talking about 60-70% obstruction. Then you only pick it up maybe 60 or 70% of the time. And then, of course, you get a bunch of false positives. So you get people that look like, oh my gosh, and then we're not happy to offer them insurance, and then they go off and they get angiogram done, and there's no disease. So the test is not a great test, but it's a test we've been using. One of the things that we're looking at is to replace that test with coronary artery calcium, because of course you're not just looking at the one called end-stage disease, but advanced coronary artery disease. You're looking at the full spectrum. So that's the first benefit, is that you're not just catching the late stage disease, you're catching middle stage and early disease as well. And of course, when you catch it early and middle stage, not only do we, as an organization, then know that this person actually has coronary artery disease, whereas we may have thought they didn't, had we done a stress test, but that person can then get the appropriate treatment to address their risk factors. So it's good for them, it's good for us, and it just makes a whole lot more sense. And of course, you don't get false positives on a calcium score, right? The calcium's there and it's in the coronary arteries. The person has CAD.
Exactly, and a super high score is 20 times the risk of an event of a 0 score, regardless of your age. So it speaks to the power. But yeah, I must say that resonates with me because the stress test, actually, when you look through the data, is very poor, as you describe. It's better than nothing, but quite poor. And David Bobbitt, actually my sponsor of Irish Heart Disease Awareness, he's a typical example. He aced his stress tests, top 10% of fitness, and he had 1,000 score and 3 blocked arteries. So yeah, the other thing is the power of 0 then, which came out as a campaign in the last few years and culminated possibly in helping the 2018 guidelines enshrining calcification. But the 0 scoring people you get then, you know they're really low risk.
Yes, and of course what we can then do is, if somebody has a certain risk factor that we possibly worry about related to coronary artery disease, but we then see that, so underwriting and assessing risk is not a perfect science. Of course, there are calculators, Q-risk score, Q-risk 3, whatever, that one can use. We have our own internal guidelines, but they're not absolute. And so often, particularly these high sum assured cases, get referred to doctors who work for Swiss Re, and they then have to decide where that risk is. And of course, we give debits and credits depending on what we find. And certainly in terms of metabolic disease, things like triglycerides, HDL, play a big role. And a calcium score of 0 would play a huge role, absolutely huge role for me.
Right, but currently the calcium score, like in a lot of the other industries, and even the guidelines to a point, currently it's really used very little. I mean, you have specific insight into the CAC score, which we're discussing, but your colleagues and people across the business currently?
No, it's not a widespread, there's very little widespread use, and it's certainly something we're trying to expand. But as I say, it's hard to move a big ship, but I think a lot of people are beginning to realize that there is value. And every now and then we do get, particularly the high sum assured people, taking out big covers, would have gone to a cardiologist who kind of would have seen the light and would have done a calcium score, and then we get the calcium score, which is great. But currently it's not a requirement. So it's not something we ask somebody to do, although my aim is to try and change that.
Excellent. And just to that point about you mentioned to me that sometimes you actually ask for an angiogram in very high risk clients. Interestingly, the approximate statistic is if you have a 0 calcium score, you're around 99% assured of not having a stenosis greater than 50 or 70%. So incredible accuracy there.
Absolutely.
So you are going to be part of this new movement to get calcification adopted across the world, both to save people, as you say, and get them the right treatment, but also from a business sense to get much better business accuracy in assessing, what kinds of premiums should be charged.
Absolutely.
Great job, John. Thanks a lot.
Thanks, Ivor. Cheers.
This podcast is only possible due to funding from David Bobbitt and the Irish Heart Disease Awareness Charity. For middle-aged people, it is imperative to find out your heart attack risk by getting a CT scan of the heart and your CAC score. The new ihda.ie website has all the scan resources. Please support us by visiting and sharing widely. Knowing your score, you can take action to stop the disease process and save your own life. It can even be as simple as removing sugar, refined carbs and seed oils, i.e. processed food, from your diet.